Hello and welcome to DocTalks, the vodcast, a Doctors of BC production. I'd like to begin by respectfully acknowledging the land on which I am on currently. I'm on the unceded traditional territories of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations. I'm honored to be here as a settler. I'm thrilled to introduce a panel of distinguished guests, including Dr. Melissa Lem, Dr. Warren Bell, Dr. Douglas Courtemanche, to discuss the critical topic of climate change, planetary health, and how doctors can have an impact. Dr. Melissa Lem is a Vancouver family physician who also works in rural and northern communities. She's the president of the Canadian Association of Physicians for the Environment. She's a director of park prescriptions for the BC Parks Foundation. She's an internationally recognized leader in the nature and health movement. As a widely published writer, climate change panelist on CBC Radio's Early Edition, she's an in-house medical columnist for CBC TV Vancouver and a clinical assistant professor at the University of British Columbia. One of Dr. Lem's major priorities is knowledge translation. Welcome, Dr. Lem. And Dr. Warren Bell is a family physician who has practiced in Salmon Arm for 43 years. He's the past founding president of CAPE, again, the Canadian Association for Physicians for the Environment, and has been an environment and global health advocate since the 1980s. And Dr. Douglas Courtemanche is an investigator and craniofacial plastic surgeon and the director of Vascular Anomalies Clinic at BC Children's Hospital. He has been in practice in BC for over 30 years. He's a member of Doctors for Planetary Health and participated in the rally last November at the legislature, asking the provincial government to declare a climate health emergency. He has met with Minister Hyman to discuss the intersection of climate change, health, and mental health. Along with fellow D4PH colleague, Dr. Rashmi Chadha, they have jointly and separately presented planetary health grand rounds to many and varied physician groups across the Lower Mainland, UBC, and the province, as well as to the Provincial Department of Surgery in Saskatchewan. So without further ado, thank you for joining me today. And let's start the discussion with our first question. You each have unique backgrounds and experiences. How did you get into climate action and why is it important for you? If I can start with Dr. Melissa Lem, please share.
Thanks, Dr. Dosanjh. Well, the truth is that I'm a lifelong tree hugger. It's actually a nickname that my siblings and my parents gave to me to make fun of me when I was growing up. So I was that kid who was always pushing their family to recycle. I gave an elementary school speech on saving the rainforest. My grade 12 science fair project was actually using plant seedling leaves as biomonitors to monitor levels of air pollution in an environmentally friendly way. So this interest in nature and the environment, and then hence climate change, I guess, runs all the way back to my childhood. And then when I was a physician and I discovered this huge body of evidence behind the health benefits of nature, I thought, this is it. This is something I can pour my time and my energy into. And then in the meantime, the energy behind the climate advocacy movement was growing in Canada. And to be honest, to be 100% honest, I avoided it for a few years because I was really happy to just stay inside my happy and safe little nature and health space. But then when my son was 3 months old and I was spending a lot of time sitting on my bum, nursing, I decided to read Naomi Klein's book, This Changes Everything. And it changed the course of my advocacy because it laid bare for me the utter death and disruption we would see if we didn't take action on climate change. And from that point on, this was about 8 years ago now, I started looking for ways to get involved in climate action. And then when I moved to Vancouver at the end of 2015, eventually I joined the BC chapter of CAPE, met the incredible Dr. Warren Bell, gradually started engaging with decision makers at all levels of government, and then also, as you mentioned, started engaging my communication skills. I've been appearing as a medical expert on TV for over a decade now, and have worked as a senior writer for the CBC for years. And so I brought those communication skills that I learned together, and then eventually became, a climate panelist on CBC Radio, and I do interviews all the time with media in my roles with the BC Parks Foundation and with CAPE. And I guess the reason why climate action is so important to me really comes down to my family and my patients. Over the past few years, I've seen increasingly that their health is affected by climate change, whether it's the wildfires or the heat, or whether it's climate anxiety, their mental health. And then just looking at my son, I want to be able to say to him in 30 years or 20 years, look him in the eye and say, I did everything I could to make sure you had a healthy future. And I think this is really this big grand story that we're all writing together right now. I think the people sitting in this virtual room together right now are some of the heroes of the climate movement. And it's a pleasure to be here and talk about this with you today.
Well, thank you so much for that amazing answer. I'm going to ask Dr. Warren Bell himself, founding member of CAPE. Please let our audience and our listeners know what compelled you to get into climate action and why is it so important to you?
Well, thank you very much, Ramneek, and it's delightful to be here. I'm on the territory, unceded and essentially stolen of Secwepemc people here in Salmon Arm. I think it's always been there, a little bit of critical analysis, starting when I was a kid. We had a compost heap when everybody else was buying herbicides and insecticides. My father used to have the Journal of the Soil Association, which is one of the early organic farming entities in the planet from UK, sitting on our kitchen table. And I thought nothing of it. I just thought my father was a little different, and on we went. Recycling was always there. We started, as the years went by, when we were in Montreal in the 70s, recycling tin cans and newspapers and cardboard. I think we probably produced more greenhouse gases taking recyclables to their destination, all of them separate. But it seemed like the right thing to do. One of the reasons we left Montreal was that there was a bit of a scandal when it was discovered, if you want to call it that the outfall for sewage, treated sewage, was upstream from the intake for drinking water for the city of Montreal, which was a bit of a wake-up call. But I think it's like Topsy, as each facet of our relationship with the ecosystem is brought forward either by new information or by public attention, it's just fitted into this trajectory that I seem to have been on for a desperately long period of time. So there's no one event, but there's been a whole series of events that just up the ante as we go along. One of the most recent being that that Antonio Guterres of the United Nations said just within the last 24 hours, we're on a highway to climate hell with our foot on the accelerator. And I think that's not far off the reality of what we're dealing with. So there we are.
Thank you so much for sharing your journey and your perspective. And now, Dr. Courtemanche, if you would be willing to share what brought you to climate action and why is it so important to you?
Thank you. So I'm coming to you from what I consider Musqueam territory. I live 2 blocks from the Camosun Bog, which is the headwaters of their stream. So even though it's the Shared Coast Salish territory, it's pretty much Musqueam here. So I really appreciate that. And I get to walk there with my dog in the woods and enjoy that. I kind of grew up on the land. I grew up in Vancouver and my dad had a boat. So I also grew up on the water and I feel really grounded in the place that I'm in. I've been recycling for 44 years. When I was a university student, we had boxes in our hallway at the basement door. So we had a basement suite and we separated our glass and tins and paper. And then once a month, we would borrow my mother-in-law's car and drive down to the recycling depot and get rid of it all. And I've been a cycle commuter for 50 years.
Wow.
So, or almost anyway. So and also I've become a really strong advocate for social justice based upon some things I kind of learned by chance along the way and books that I got referred to and thought, oh, I should read that. And also in part for the cleft palate program at our hospital at Children's, and more generally with respect to Indigenous issues in BC, starting with, being asked to and then reading the TRC in 2016. And after a deep dive into Indigenous literature and listening to podcasts, I've come to realize that climate and social justice are really intricately linked together, like they're not separate problems. The more I've come to understand about the climate crisis, the more urgent it seems to become to me. About a year ago, there were a series of lectures at VGH about climate and health. And I would sit in the back and ask a few pointed questions. And our colleague, Dr. Rashmi Chadha, recruited me to Doctors for Planetary Health. It's like, you have to join our group. And since joining them and doing a lot of, learning and reading literature and looking at evidence, I really think, I've found my tribe. And I realize the importance of doing this now.
Thank you. I'm going to get right into our questions that I think I definitely want some, expertise, knowledge. And while we have three giants in climate action, especially in our physician community, who better to ask? So I'm just going to, obviously we know in BC we've had a dry, warm fall that has led to drought conditions. And last year we saw epic flooding, which is increasing the urgency of the movement, as Dr. Bell and Dr. Antonio Guterres, United Nations, has been pushing this issue, and it's a world health issue. But here, why is this an issue that cannot be put on the back burner? I'm going to ask all of you to answer, but maybe Dr. Bell, if you think you can kind of take a little deep dive into that. Why can't we wait any longer?
I think a short, simple answer to that question is that the costs in every sphere, physical, emotional, spiritual, of not acting are progressively exceeding the costs of maintaining the status quo. We are faced, as most people will say, with an existential crisis. This is our existence as a healthy species on the planet. We are playing with that. Well, not really playing with it, because we didn't realize how serious it was until the last few decades. But we are, by not addressing it, sealing our fate, and the fate particularly of generations to come, the next half a dozen generations at the very least, to deal with pernicious and unnecessary hardships that we, through our inaction, have generated. So that's what I think it is. The cost of not acting exceeds the cost of the cost that we're having to face right now.
Well, if that wasn't a call to action for our listeners today, I don't know what will be. That's really compelling. And I think I'm going to ask the same question to Dr. Courtemanche. Why is this issue? Why can't it be put on the back burner? If you have anything to add.
Well, my understanding is that this DocTalks Vodcast is for physicians and for the members of Doctors of BC. So here's a medical analogy for you. What is the fate of a person with a fever of 38.5 degrees or higher that never breaks? Are they septic? Are they toxic? Will they die? So our planet currently has a fever of 1.2 degrees above normal and no signs of going down. So all the various climate changes are evidence of the disruption of the Earth as a stable organism, if you think about the Gaia hypothesis. So in medicine, when we make a diagnosis, we then think about what's the natural history, what's the prognosis, what's the severity, and what's the urgency. And we need to apply those skills to our approach to the climate crisis.
That's amazing analogy that you use. It's almost the, fever of unknown origin, but in this case, we know the origin, but you're right, it's not breaking. And that could be so devastating in clinical practice. And I think very relevant for pediatrics, but very relevant for the general population. Well put. And Dr. Lem, I'm going to ask you the same question. Why can't this issue be put on the back burner?
I want to point out that climate change is not the only health emergency we have that's driven by the combustion of fossil fuels. We, at the same time, have an air pollution emergency. Right. A lot of people don't know this, but air pollution from burning fossil fuels is responsible for 1 in 5 premature deaths worldwide. And in Canada, it's 1 in 7. And up to 34,000 people die every year from PM 2.5, or fine particulate matter, released from burning fossil fuels. And so for those who don't know, if you're a member of the general public, the inflammation caused by this fine particulate contributes to heart disease, lung disease, stroke, cancer. And then when you don't even count deaths, it can lead to adverse pregnancy outcomes, developmental issues in kids, mental health issues. So not only are fossil fuels driving climate change, but they're also literally making the air that we breathe dangerous. But on the flip side, if we engage in climate action, if we invest in community and urban infrastructure that promote a low carbon lifestyle, from, for example, more bike lanes and accessible sidewalks to better public transportation networks, and the shift away from car culture, getting natural gas out of our homes. So that clears the air within our homes themselves, tree canopy and green space so people actually want to spend time outside. These measures will all clear the air too, which will improve our health right away as we give up fossil fuels. So true story, my son, he's in grade 3 right now. He knows all about the health harms of fossil fuel fumes. When we smell exhaust from cars, he will complain, wrinkle his nose, run down the sidewalk to get away from the smell because he knows it's bad for his health. And I think every doctor, every health professional needs to know this. And when they think about climate change and fossil fuels that are driving it, they have to think about air pollution at the same time.
I mean, again, you heard it here. 1 in 7, 34,000 people that prematurely die from fossil fuels. I mean, that's, again, a compelling statement. And we need to be bringing this through our, evidence in our lectures and what we're hearing and changing the way we practice medicine in our homes, but also in our environments. And I think you guys raised some really good, we'll get into solutions a little deeper in a minute. But when you spoke about your son, I can just imagine, Melissa, in the next generation, what it's going to look like, and what, you've already given birth to an amazing climate activist and a change agent. When I had the pleasure of meeting him briefly at an event, and I just think it's inspiring. But I have a question for Dr. Courtemanche as well. Is I often hear from many people, maybe Greta Thunberg around the world, people see climate activism as radical or mostly for the young people of the world. How can the movement be more inclusive, given that this issue affects absolutely everyone? And basically commenting on the What Next on Climate article that was that you're very familiar with yourself.
Yeah, I'm proud to be a grandfather that's a dangerous radical. Given that climate change is affecting all of us, and regardless of whether you're personally financially secure or not, it's going to affect everyone in the future. So we really all need to work together. Physicians can lend the credibility of their white coats and their stethoscopes to public activities that demonstrate that people want the government to change course, and they want them to abandon the sort of corporate colonial enterprise that's killing us all. So that's a pretty radical statement. People are going to have to do a bit of homework maybe to unpack that when they just hear that right up front. But, when observers go by a protest outside the Royal Bank at Broadway and McDonald last Saturday, and they see doctors for Planetary Health with their signs and their flags and their white coats and stethoscopes, they're going to think, oh, doctors are concerned about this. Maybe this is important. Maybe I should pay attention. Maybe I should do something. I mean, we have to use our street cred in some way to raise awareness and get engagement.
That's great. I think you're absolutely right. I think to the street cred, despite all of the naysayers, and we get this negative feedback time to time as well. But as physicians, we are also leaders of healthcare and healthcare outcomes. And there is a shared responsibility that you speak of. I'm also going to ask Dr. Melissa Lem to speak more about the health and health systems. I know you got a little bit into the air pollution and the effects and air quality on our health. But what are the interconnections that you think between human and ecological health? And to describe on a systems level, a big picture, that why is it a public health issue and how is it affecting our health systems and patient care in BC and Canada?
I think we've all seen it, especially here on the West Coast. I live on the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations, and we've seen our health systems pushed to the brink multiple times this year. But I want to zoom out a little more to talk about what we're seeing in Canada in every province and territory. So there's lack of traditional access to foods in the north due to melting and shifting sea ice. We've seen ORs close in Alberta because of wildfire smoke that affects indoor air quality and makes it unsafe to operate them. There's been drought affecting food security in the prairies, increased rates of Lyme disease and allergies in central Canada. People have literally lost their homes and livelihoods on the East Coast because of storm surges and rising sea levels. And just back to the West Coast, we saw our emergency systems implode during the heat dome here in the Lower Mainland, with firefighters and family members literally having to do CPR in driveways because no ambulance was available. I do rural emergency work, but that week I was at my community practice here in Vancouver, and I remember talking to my emergency colleagues, and they said that those shifts were the worst of their entire careers. They were literally running from room to room, intubating patients, seizing and unconscious because of heat stroke. And I mean, if that doesn't kind of get to the core of why we have to be worried about this as healthcare professionals, if you want to take this purely dispassionate look at the numbers, even without thinking about the human suffering, The Canadian Institute for Climate Choices, they're an Ottawa-based think tank, an evidence-based think tank, and they've released a report last year saying that by 2050, if we follow a high emissions pathway, so looking at warming of 4.5 degrees by the end of the century, climate change will cost the Canadian healthcare system over $110 billion per year by mid-century. While if we follow a low emissions pathway, because we already have some climate change locked in, it'll cost us an additional $58 billion per year. By the end of the century, the divide grows even further. So on a high emissions pathway, the health costs of climate change are $270 billion extra per year versus $100 billion per year on a low emissions pathway. And then when you think back to how our health systems are already so close to the line, I can't even imagine how we're going to find an extra $110 billion per year in the next 3 decades to fund our healthcare system. So investing in climate action now will literally save billions of dollars in the future and make sure we still have a functioning healthcare system. And I think one of the greatest injustices of climate change, especially around the world, but in Canada too, is that the people in Canada who are the least responsible for driving it will be affected the most by climate change. So we're talking children who have their whole lives ahead of them, low-income seniors, Indigenous peoples. And it's something that's happening on an even larger scale around the world, with over 30 million people in Pakistan displaced by flooding this past year, massive drought in China, deadly heat waves in India. Climate change is a humanitarian crisis within our own country and across the world. And I think this is why coming together to tackle climate change by having these conversations and taking action together is the greatest opportunity to improve public health of our time.
Thank you so much. And again, for so many examples of why we need to change. And, Dr. Bell said the status quo has to go. That's what we've been, trying to instill within healthcare change, especially transformational change. And this is compelling enough to not only change in healthcare. I know we're addressing some of this talk right now in the healthcare sphere, but I'm hoping that other listeners and our contacts within our partners, and it will be able to leverage change from the government aspect. And Melissa, you speak of fiscal responsibility and accountability as well. Again, what Dr. Courtemanche has said is the link between social justice and climate change. Another very strong and important point to be made here. Can you comment, Dr. Courtemanche, on the effects on hospital care?
Well, I can follow on from Melissa's list. It becomes like, here are all the really scary things. It's kind of like a frightening list. So the 2 biggest health issues are heat and air pollution, which we've already heard kill millions of people every year worldwide. And like in BC, the heat dome last year had the greatest rate of death for any health crisis, more than COVID and more than the opioid crisis in terms of rate of death over the term of it. And the long-term health effects of heat and air pollution are hypertension, cardiovascular disease, respiratory disease, and cancer. And those will become acute care medical problems. If you look at the top 10 diseases requiring medical or hospital intervention worldwide, after childbirth, the diseases caused by air pollution and heat are 5 of the top 10. And the 2 others are mental health problems, which are also exacerbated by climate change. So there's a huge impact on acute care.
Thank you. And Dr. Bell, can you address the effects on rural communities and family practice with links to climate change?
In one word, dramatic. The heat dome was, of course, dramatic, and we must remember that 1 billion life forms were destroyed on the shoreline of this province, and that's something that you see when you move out of the cities and you look out in the landscape. You see what's going on at the landscape level. There are people, even this year, when we had an extended drought through the middle part of the summer, were watering trees in the forest. They were going in with watering cans to try and, some trees like cedar are very drought sensitive. But in terms of like daily impacts, Lordy, the wildfires were everywhere. I remember looking daily at the weather report and going to the Forest Service's list of wildfires in their state of control or lack of control, and really having a sort of peculiar sense of panic sort of underlying everything that was going on, sort of in the background. Air quality because of forest fires was at times abysmal. Melissa talked about the 2.5 micron fine particulate matter. Well, we had everything from 1 to 10 to 20. I mean, big chunks of stuff floating around, and the fine stuff. All the highways last fall were all the north-south highways in the province were cut off, and I have photographs of empty shelves in the grocery stores that lasted for a week. I mean, it didn't kill people, but it was a very dire warning of how vulnerable our infrastructure is in our societies at large. And I had my first experience of solastalgia. Solastalgia is a term coined by Glenn Albrecht, who's an Australian. They call him a philosopher. He's sort of a closet environmentalist with an academic raiment on. But he coined the term to mean feeling homesick while you're still at home, because your home has been so altered by everything from industrial development to ecological catastrophe that when you look out at the landscape where you live, you don't feel like you are at home anymore. And I felt that looking at the hills around where I live and not being able to see them because there was so much smoke in the air, and windows, having to shut windows even when it was stiflingly hot because you just couldn't leave them open and have the particulate come in, and the smell of smoke was everywhere. So the impact here. I want to mention one final thing, and that was suicide. One of my colleagues working in an emergency room here had at least 3 patients who came to her, one having made multiple attempted suicide through multiple means. Pills, she was a kid, she made in her 13 or 14, she made a thank God, not very successful attempt to cut her wrists. She took pills, took alcohol. And she came in and she said, I just can't deal with the pressure of what's happening to the world around me and how it seems to be, there's no hope for me in the future. And there were a couple of others who came in as well. That is borne out by research around the world, showing that young people are just feeling desperate all over the place. And we underestimate the impact of this psychological burden that people carry because of ecological devastation. And in the rural communities, it's all around you, so you see it more starkly.
Again, I think listening to this, it does, and watching the world, literally in flames, and sometimes the backyards, and what many of our listeners know and feel, and it's tangible. And the rate of acceleration, as you've spoken to, is devastating, and the effects. And we think of our most vulnerable, most marginalized populations, even the access to care right now, when we think about rural communities and our Indigenous peoples and other racialized and marginalized groups, it's just been detrimental to their health. And, we speak about advocacy. When you think about who can advocate, you guys are exemplars in this, in the world of what you guys come with the advocacy lens. I am curious for our listeners today if they want to get involved in advocacy efforts as well, which I think no physician can say that they are not going to listen to this vodcast and change the way, either in small ways, but in a guaranteed commitment, because we owe it to our patients and who we're trying to protect. But if you can help us understand, at least our listeners understand, what the roles of different types of climate advocacy are and how can they work together. For example, what's the difference between the mandates of CAPE and Doctors for Planetary Health, and how are they complementary? So just that people have an understanding of what the different organizational lenses are, what are your mandates, and what are your drivers. Very similar causes, but what's the differentiation between the organizations? If you can please elaborate.
Should I go? It's hard to know who's
Go for it,
specifically. I mean, Dr. Bell, Warren, my colleague, you founded CAPE. You were a co-founder of CAPE. So I would say you probably have a good sense of its mission. It really struck me when you said since the 1980s, you've been advocating at this intersection of health and the environment. I was born in the 1980s. So I'm thinking, how can I even speak at this point? But I think one of the main differences between CAPE and Doctors for Planetary Health is CAPE is a national organization. We have paid staff, we fundraise, we're a nonprofit, we're a charity. Something that I'm really happy about is over the course of the pandemic, our budget has tripled to quadrupled. So we went from kind of like a shell of 2 staff to 15 staff now on the basis of fundraising from foundations, from individual members like physicians who are really concerned about climate change. Our organization has grown by leaps and bounds. But when you have a big organization like that, you have to have a structure, you have to have bylaws. You become a little bit less nimble. I think we are pretty nimble because we do have a fairly small board and a fairly small staff who are fantastic. I'm really grateful to work with them. But there are processes that you have to work through. And we don't really view ourselves as a grassroots organization anymore, even though we are pretty small. We punch really far above our weight. We do have processes we need to go by. And I think, I might be speaking incorrectly here, Dr. Courtemanche, but Doctors for Planetary Health is more of a grassroots organization. You are even more nimble than CAPE, and very local also in your purview. CAPE takes a national view, and then I think each Doctors for Planetary Health chapter looks very locally at what they can do while also speaking to decision makers. But I think that's the main difference: is big national organization with a decades-long history and its own set of bylaws and staff, and then I think D4PH is very member-driven and local.
So before I ask Dr. Courtemanche, I just have to, I think, and I know you always shy away from accolades. Every time I've seen you speak, you leave the room before they even get to give you the round of applause. And I just have to acknowledge, Dr. Bell, that I've heard you many times, and I, in awe of your inspiration that you've actually, Dr. Lem is obviously here because of you, as are many of our listeners, and I've heard from our residents to our medical students to so many physicians on the ground, and the impact that you've had is an understatement, and we can't really tell everyone the magnitude, and you're so humble in your journey. But over 40 years, the founding member of CAPE. Did you think that you'd have this level of impact? I mean, I go back to that, innovation or the idea, and just, I have to do this.
Ramnik, when CAPE started, there was a small room with half a dozen people in it, and we had no staff and we had no money. At one point, we realized when we were meeting in the meeting room of the Canadian Medical Association that we had not actually, even us, signed up again for a membership. So we all immediately pulled our wallets out and put some money on the table, and that was restarting CAPE. In case any of you think otherwise, I always have a feeling I'm not doing enough. I always have a feeling there's so much more that could be done. And I see the pace of change accelerating. The number of people, for example, when CAPE first started out, we were a policy organization, and we've always been sort of an organization that addressed large-scale policies, where they're federal, provincial, and didn't actually involve ourselves very much with on-the-street activity. And it's simply because there weren't any of us. We had quite an influence on a number of policies, but that was where we sort of maintained our presence. Now, what's happening is that so many more people are becoming involved. Our profession, for example, has been studiously directed elsewhere. And I must confess, if we're going to pass a little praise around, Ramnik, you have made a significant difference in the way doctors of BC focus their attention on this. Just having this vodcast put together is a significant departure from past disposition of energies. And I think that in itself is really a very positive turn of events. It's a sign of changing times. So I started early because I was sort of, my lifeblood was, wondering why we were doing what we were doing. And then if we were doing something that didn't make sense, saying, well, let's do something different. But now I see not the fruit of my labors, the fruit of human consciousness evolving in a very profound way. We're starting to think about other people the way we should have been thinking a long time ago, not as an aspirational moral preamble to personal change, but as a survival tactic. We just have to start thinking about one another and how we do things far more. So thank you for your kind words, and I'll throw a few back at you, and we can move on to the real meat of the matter.
I think that you had me there at the human awakening and the collective consciousness, which I really hope the intent for me to even start a vodcast in any direction with physicians, when I know I'm in a position to represent so many of you that do such amazing contributions to humankind, really. I really think the sole purpose of this is to address that awakening and that awareness, and really returning to the roots. And you said it earlier a little, you touched on the spirit, and it's hard to not be aware in nature and recognize the spiritual health and well-being of others, and making space. And with that as well, all of your activism on the grassroots level. Dr. Courtemanche, if you want to add anything else about the Doctors for Planetary Health and their political advocacy and the capacity.
Well, Doctors for Planetary Health was born out of what probably was Extinction Rebellion MD locally. And that was not felt to be really the way doctors should go about being involved publicly. So they changed their hats. And that was Rashmi Chadha and Linda Thayer. And there's probably someone else in there. Bob Stowe also is one of the early founders. But anyway, I'm not an expert in non-violent direct action. So my perspective and understanding is that the action needs to be public, because not enough people are aware and engaged in solving the problems of the climate crisis. But we aim to be respectful but direct, and we hope to get some media attention so the public has the opportunity to be informed and educated. And actually, it's surprising how difficult it is to get media attention in mainstream media. We don't want to be in a position where we're burning bridges of communication with government, right, for ourselves or for CAPE or for Doctors of BC. Right. Almost everybody in Doctors for Planetary Health is a member of CAPE, and both, I think Warren comes to some of our meetings, and Melissa was a speaker at our rally in Victoria. So we're all interconnected. It's not a competition in any way. Like, we're all seriously focused on trying to solve the same problem and help each other. You know, there was a decolonial solidarity Zoom event prior to this weekend's big protest against the Royal Bank, and chiefs from Wet'suwet'en Nation were on, and Namak said that the moral deficit in society is larger than the economic deficit. Mm-hmm. And Was said, this is my favorite quote, he says, we have to ask government, in quotes, what the hell is going on, close quotes. And then he said, oh, not in that tone, but put some anger into it. You know, like, you have to be respectful but direct. And that's kind of the line we're all trying to tread. So anyway.
I love that. We're not in an economic deficit. We are in a moral deficit. Oh, if that's not a take-home pearl today, I think that's right into my soul's work, definitely. And I think that's, again, speaks to the consciousness of what we can do together in all of our advocacy and our efforts. And I think even from an organizational framework with Doctors of BC, I think we really need to be representative of all of our physician and inclusive. And why I think climate change is a public health issue is all the reasons that you've so eloquently stated today. But the most compelling reason is that we are in service to humans and their well-being and health. And there's everything, like you said, is synergistic. Climate action is public health, you know, and we think the greatest public health pandemic, as we've navigated multiple recently, but this being one of the most compelling, because it's going to take all of us interconnected and reliant on one another, but us as champions, you guys at the front and face, but also all of us in our clinics or in our hospital environments to kind of challenge again, push up against that status quo and don't accept it anymore. You know, there's many ways that we can actually just change the way we do things. And I'm going to ask you that now, is that what can we do as individuals, as physicians in the clinic and in the healthcare system to best support planetary health effort? Because I know most of our listeners right now, by now, are saying, okay, what kind of changes can I make radically overnight? Do I need to become a vegan, or do I need to get my single-use supplies, or what paper? For example, I said this to Melissa. I said, you know, I had also an opportunity to speak with Dr. Klein as well, and say that imagine if we made EMR, interoperability and digital health transformation, with the compelling argument of climate change, just to decrease our paper or waste consumption, for example. How fast could we make that happen? And so I'm going to put it to the three of you again. Please let our listeners know what they can do as both as individuals, but as physicians or healthcare providers in their clinic setting, hospital setting, and bigger overarching healthcare system goals.
I've been just a couple of things I was going to add to what you were saying, Ramneek, because I think they're really important. And you mentioned EMR. Well, people have started to look at cloud computing, and EMR is very dependent on cloud computing because of the volume of data that are produced. Cloud computing is extraordinarily energy consumptive. There are buildings that are the size of 4 football fields filled with air-conditioned space in which masses of computers are whirring away constantly 24/7. And they not only consume energy, electrical energy, they consume an enormous amount of water to keep them cool. It's like literally hundreds of millions of gallons a year. And in a day, they can 100,000, 200,000 liters is nothing. And it's just an example of how complicated it is. Something that on face value looks like it's going to save the trees from being cut down, right, is using energy. And if we get it from fossil fuel sources, which is where a lot of it comes from still, we're sort of backing ourselves into another corner. This Chinese doll, this Russian box set of nested containers, when we pull one off, there's another one inside, then we keep on pulling them off. And that's why it's a spiritual exercise, because we're basically left with no firm ground except to accept change and to move with it. I have a couple of slides that I could, because I think they're very illustrative of the issues we're discussing right now. What I'm showing on this slide is the amount of carbon dioxide equivalent generated by a single person in his or her lifetime in Bangladesh and in the United States, which could be a proxy for Canada, and Bangladesh could be a proxy for many countries around the world in the so-called global south. The Bangladeshi citizen is generating in his or her lifetime about 56 tons of carbon dioxide equivalent. That's all the various greenhouse gases, related to the impact of carbon dioxide. In the United States, the average person would be generating not 56, but 9,441 tons of CO2 equivalent in their lifetime. So the issue rests with us in this part of the world. We are the leaders in fueling the climate crisis. Now, the second slide is simply an illustration of Canadian healthcare system, which is a very expensive healthcare system compared to many around the world. Right. And it produces about just under 5% of all the total emissions of greenhouse gases in this country. And those two slides are just showing how much work there really is to be done if we're going to make the healthcare system climate friendly. There's many things that we have to do. One is the way we practice from day to day. If you order any test you order involves energy, time, money, etc., and energy, and is distracting. There's an opportunity cost to every test that you don't do something else that used less energy or was more productive or practical. So I won't continue with this, but I will say that I have been doing psychotherapy for 40 years plus, 42 years, and insight-oriented psychotherapy reaches into people's consciousness. And when you look there, you see how attached we are to habits of mind, habits of behavior. And now we're being challenged to shift those on a fairly global scale, global internally and globally in a sense of the entire planet, which is why listeners or viewers will see that I am speaking to you from my satellite well above the troposphere of the Earth, so that you get a big picture. Anyway, thank you.
Well, I think with the big picture, but you did touch on a few things. So you would say, be more conscious of the tests you're ordering. And we don't have a quick answer, obviously, to change on how we clinically operate within, if we're using paper charts versus EMR, but you have made a very tremendous argument against the cloud, which I absolutely heard you loud and clear here, as much as our listeners did. But what are other just simple things that could be simple, quick fixes, changes? I know there's nothing quick fix, but I think if someone was to take home, I mean, that's a ironic statement in itself, and that could be pretty triggering. But I mean, in the sense of what I know, most of the people that I'm hearing on the ground is that change, that resistance to change. You're speaking about the psychotherapy and the habits of change, and we know where a lot of people are stuck on things that they've been using for many years, and whether that's a mindset shift or just a day-to-day shift. I don't know, Dr. Lem, even in your own practice, in your own clinic, have there been modifications that you've been able to use that's a little bit more climate conscious or climate aware that you could have some of our maybe listeners adopt?
You know what I think the most effective change, personal change that I've made in my medical practice is actually shifting what kind of inhalers I prescribe. And this is actually a really easy change that everyone listening to this podcast or watching this podcast could make. So switching from a meter dose inhaler that has propellants in it that are powerful greenhouse gases to dry powder inhalers, which emit far fewer greenhouse gases. And so it's actually similar when you switch someone over from an MDI to a DPI per year, it's similar to actually eliminating the carbon emissions of meat from their diet. So if you think about every patient you can switch over to a DPI, it's like them going vegetarian. Right. That's pretty incredible, because we know that that's one of the most major changes that someone can make in their everyday lifestyle that will reduce their own personal carbon emissions. But I think something else I want to point out is there are so many different ways we can reduce carbon in our practices and in our patients. It's like a choose your own adventure thing, right? A choose your own adventure scenario, because whether you're passionate about active transportation, about spending time outside, about quality control, there's so many different things that we can do. So I think what's really important is to figure out what you're passionate about, what's really interesting to you, find out how you can make a climate positive change that will incorporate that passion of yours, and then go full tilt into it, and find people you can work on that issue with, like your regional CAPE committee or a local Doctors for Planetary Health group. It's really important to have that social support and to have colleagues to bounce that idea off. So, and then if you want to go beyond individual change or kind of this individual level practice change, I want to talk about what CAPE's doing, for example. So Dr. Bell, actually, Warren alluded to this emergency physician in Salmon Arm, and she's in fact Dr. Lori Adamson. She's a mom and an emergency doc. I'm pretty sure that's who you're talking about, Warren, not to give it away. But she joined. Yes, she joined BC CAPE after the heat dome and started learning about different climate issues and where action was needed in BC, and found out about natural gas and how that contributes to a huge amount of our carbon emissions, our carbon pollution. And so her antenna was up. And when her son brought home science materials from BC's major natural gas utility, she was horrified. She thought, oh my goodness, fossil fuel propaganda is here in my home. And that, in fact, launched this big campaign that we helped her with, where we essentially wrote an open letter to the Minister of Education, which ended up being signed by almost 100 different health and education and community organizations, that asked them to end fossil fuel. I'm trying to think what the word we used was. It wasn't propaganda, fossil fuel promotion in BC schools. And in fact, this led to nationwide media coverage. The education minister actually struck a committee to look at the state of climate change education within BC, and found that a lot of students felt that their climate change education was not up to snuff. And so they're looking into making sure that climate education resources are readily available to teachers and students. And just looking into changing, perhaps, we haven't gotten a commitment on that yet, but perhaps changing who can advertise within schools. So I think the fact that this mom, this new climate advocate, was inspired to launch this campaign on the basis of an interaction with her child was incredible. And then on a larger scale, I want to talk about CAPE's fossil fuel ad ban campaign, which is where we're looking for government and regulators to ban ads for fossil fuels and internal combustion vehicles and tackle greenwashing to reduce consumer demand for fossil fuels. This campaign, I'm really proud of it because it managed to gain the support of the College of Family Physicians of Canada, the Royal College of Physicians and Surgeons of Canada, and these are not tree-hugging environmental activist organizations. These represent the mainstream of medical practice in Canada, and altogether the signatories to our Fossil Fuel At-Ban campaign include over 700,000 healthcare professionals in this country. And so CAPE is helping to take climate action mainstream. And again, we've had some very positive responses from government and regulators to date. If you want to learn more about that campaign and sign on to support it, check out stopfossilfuelads.ca or sign on to our action on CAPE's website at cape.ca. And stay tuned because we actually have more exciting developments in this campaign to come.
I mean, that just speaks to the collective impact and your efforts, and from one seed to really creating a forest, a regeneration of hope. And I think that's what we can do together. And I think it's so inspiring to hear you speak of this, because that was my hope, is that I see all of our, individual efforts, but I also see this collective effort. And from the system change, I mean, you spoke about switching from the MDIs to the DPI, which, as soon as we learned that, my approach to that is, why don't we just stop funding the MDIs, period, or make them unavailable? I mean, that's just one. If we can affect pharmacare, or if we can get some input into the government and what they regulate, or, if we know the central prescribing authorities and make decisions, that's the one step, we can absolutely change that, because that's the benefit of a public health system, right? We can actually really inform change at that level. So I don't know if that's been done yet, but that's one way that we could do that. And again, simple for all the family doctors listening, but also the specialists that, prescribe inhalers. That's one quick move that we can move in that direction, and maybe talk to the hospital pharmacies and say that, let's just move over to DPI. There's no question. That's what we're going to use moving on. And that's kind of done. But this is all of what we're speaking of, that one small change, which we may have thought and a lot of it, to be honest, is the awareness, is that many of us didn't know that this is the better prescribing practice. And maybe there are impacts that we're not aware of. And we do need that committee to really look at and scrutinize our prescription or our prescribing habits, or the way we actually ask for consults or certain things in healthcare, just an overall committee to actually look at the practices that we have in our everyday. Dr. Courtemanche, do you have anything to add?
The metered dose inhaler versus DPI debate is actually quite nuanced. There's some really detailed, like total life cycle analysis papers, and the general trend is correct, but the final answer isn't in. And then there are patients who can't use them and need the old-fashioned puffers for whatever reason. Everything has a bit of a subtle twist to it. So the other thing is, for physicians, talk to your patients. Look for climate-caused health problems in your patients. Like all the things that we're talking about advising people to do and what doctors are hearing, patients need to hear as well. Like Melissa's points about PM 2.5s and Warren's about air pollution, like patients need to be asked, is this happening in your life? And then given advice about what to do about it or how to prevent it. And then there's things like greening your office. So there's a green your office toolkit. If you work in a group practice and you've got 10 garbage bins, one in every office, and you put 2 things in it every day, and then the cleaner takes out 10 plastic bags every day, just have 1 garbage bag in the hall that everybody has to share. So there's all kinds of little tiny things, but that being said, well, healthcare is 4.6% of the carbon footprint of the country. The fossil fuel industry, just to produce fossil fuels, is 26%. Like we really need to go, you want to target the big problem as well as we should get our house in order personally, but we also have to go after the other problems. And then the fourth level is lobbying government. Just as Warren said, CAPE was a policy institute and they have had an influence there. And just as for Planetary Health have, rallied in Victoria and met with ministers and stuff, we have to get the people who make the decisions to get on board as well.
Well, thank you for that. I think the interesting points that you raise, and you touch on so many aspects actually that could be moral or ethical dilemmas for many people listening today. In addition to that, you mentioned this green action or, way to make your office greener. Where would people find that information, the toolkit?
website.
CAPE website has all of that resources.
Well,
right?
it has one. There are a number of toolkits, but one of the most comprehensive ones is the one on the CAPE website.
Okay. And now when we think about what has transpired in the last few years, just here locally in our province that we've witnessed, and some of us have had to actively participate in one capacity or another, how should physicians think about the preparedness for or the planning given the climate events? And how should health emergency management and planning activities integrate physician perspectives? What could they do to ensure that physicians are well positioned to provide some care during the climate related events? Any thoughts to that? And then I'll open up to anybody. Dr.
Well,
Bell?
I'm a surgeon and I practice mainly in an acute care setting.
Right.
So I kind of like have a full, busy clinical practice life already. You know, I look after trauma and burns. Hopefully I won't see an increase in that.
Right.
But, you know, if we're going to have more sick people, we're going to need infrastructure.
Right.
And we're going to need commitment.
One of the things that I think is really important about not just the climate crisis, but what Melissa's added on, which I think is extremely important, that it's a across the board ecological disaster, is that unlike traditional models of healthcare where we, the healthy, separate people, deliver treatments or interventions or diagnostic processes to our patients, we too are subject to the ravages of ecological change and degradation. And that induces a different mindset. The mindset is not, we're going to help you with your problem, but we're going to help you because we're in the same boat that you're in, and we know that we all have to work on this together, and we're working on it. And I think coming at it from a broad level of social collegiality, not just our professional collegiality, which is, of course, important, but from a social collegiality, we're all in this mess, if you like, together, I think is a very powerful way, and it induces a different way of approaching people. You say, you know, our house is threatened just like your house is threatened by this wildfire that's out of town, and we're breathing the same smoke that you're breathing in, and it's harming everyone. And then there's, of course, the even broader association with non-human life forms, which we depend on. I mean, the idea that somehow you can't, you know, we'll keep all the people healthy without keeping the ecosystem healthy is scientifically absurd. We are interconnected. And so this kind of sense of connectedness and facing the issue together can bring about a different way of relating with our patients. We don't say we are a fount of wisdom, insight, and expertise, and we'll bestow it upon you. It's like, we're in this mess with you, and we're a little scared too. And what can we all do together that will make things go better? And sometimes even inviting input from our patients, who can sometimes have profoundly valuable insights on the way we can think about things. There's the barriers between the two sides of the equation, the patient and the physician, need to be set aside to some degree. We need to start saying, how can we work together on these issues?
I hear what you're saying, and what I hear there is social accountability, but also patient-physician partnerships.
Yeah,
and you know, public partnerships in the sense that we walk together in this walk. We're all affected by this. That's affecting all of our health and well-being. You know, as a world, in this nation, but really in locally and across this communities and across the province, is that we walk with you, and it's a collective effort. And you have articulated that very well. So I'm hoping that our listeners will understand that, and the need to, you're right, the interconnectedness, our ecosystem and our environment we're all in this together and symbiotically, you know, and if we don't take care of what we've even seen, the advancements of disease and viruses and replication and all these things are happening really because of the changes that are happening at an exponential rate. And us as humans, we need to really come together. And I think the leadership aspect from the three of you and the organizations that you also represent, but on the ground for us to lean in to one another and the collective efforts, again, that you resoundingly speak of. Dr. Lem, I'm going to speak to you change gears a little bit, because when you think about the ecosystem and I think about the relation to nature and our participation, you've done some profound and remarkable efforts that have given you, again, a worldwide platform to speak on about your nature prescribing. Can you tell us a little bit about that, if you'd be willing to share?
Thanks for asking, Ronique. So I'm the director of park prescriptions for the BC Parks Foundation, and it's Canada's National Nature Prescription Initiative. We have chapters in every province across the country, starting with a launch in BC in November 2020, and then ending with a launch in Newfoundland and Labrador in June of 2022. And it is a program where any regulated health professional in Canada, in a province where we've launched, can literally prescribe time in nature to their patients to improve their mental and physical health. And this is something that's evidence-backed. There are hundreds of studies, several decades deep, that speak to the health benefits of spending time in and around nature, from improved rates of heart disease to better cholesterol, to reduce diabetes, better mental health outcomes, better outcomes in kids. Spending time in nature is one of the best things that we can do for our health. And I think, germane to this conversation we're having right now, one of the reasons why I'm so passionate about getting people to prescribe nature is because the research shows that when people are more connected to nature across the lifespan, whether you're a child or whether you're 90 years old, that not only are you more inspired to care about nature and want to engage in conservation initiatives, but you're also more likely to engage in other pro-environmental behaviors beyond just nature conservation. So people who are more connected to nature tend to recycle more. We all talked about recycling when we were talking about our early journeys towards climate change. They tend to conserve more energy. They tend to vote for more climate advocates. So I like to think that every time I or one of my 10,000 colleagues across the country, so there are over 10,000 regulated health professionals in Canada right now registered to prescribe nature. And this includes over 5% of all practicing physicians in the country. And by the way, in BC, it's over 14% of all practicing doctors in BC are registered in our program. Thank you so much if you're listening and you're one of them. I think it's incredible. And I think we're starting to build those connections and the awareness among patients and among the profession that nature, biodiversity, ecosystems, and our health are totally intertwined. It's a fact that only 20 to 25% of our health status comes from our healthcare system, and 75 to 80% of it comes from factors in our ecosystems, in our built infrastructure, in our social infrastructure. And we can't have a healthy, functioning healthcare system without the underlying healthy ecosystem. So I like to think that that by prescribing nature, we're making decision makers, the public, physicians, other healthcare workers aware of these important links between nature and our health, and building this base of support. And that's why I spend so much time working on it. Not only because I love nature, I'm like a tree hugger grown up, but because it actually helps with climate action and it improves our health at the same time.
Well said. And if you didn't have a reason to get out and to be in nature, this is, again, another reason to be part of this beautiful program that we know that's had great uptake amongst many of you listening today. But really, again, the onus is on us to be able to represent what is needed in the world and to allow our patients to walk that walk. And I knew you got some pretty profound coverage on CNN and global news networks regarding this. And so you've really inspired other people to walk in this walk with you. So that's wonderful. And I want to speak to both Dr. Bell and Dr. Courtemanche. What resources are available, or training or education do doctors need to provide care as we see changes from the climate change occurring? And when I'm speaking about CAPE's advocacy and mobilization program, if you can elaborate a little bit on that.
CAPE has a vast storehouse. I haven't been as directly involved in CAPE's inner workings in the last while, but the storehouse of information on every aspect of environmental change is quite astonishing. So when you go to www.cape.ca, you'll find enough to keep you busy for a week or two, just reading up what's on the site. I'd also say something about the fact that CAPE is one among many groups and organizations that are working on the kinds of issues we're talking about today. And I think it's important to cross-fertilize with other groups. And when we first started, for example, when CAPE first started in the mid-90s and a bit before then, at our first AGM, we invited about a dozen other established environmental groups like Greenpeace, Friends of the Earth, Pollution Probe, etc., David Suzuki Foundation, to come to our meeting. And we said, well, we're the new kid on the block. What can we do? And they said, well, would you please endorse our programs? Because you're doctors, and if you say it, other people will probably pay more attention to it. And we started to look around at the science that had been done by groups like Pollution Probe in Toronto, analyzing health effects of air pollution. The Greenpeace organization had done a study, a very well done study on lead content and phthalate content in Chewy toys for little kids. And their work was really good. And it was a low-hanging fruit. We all, the representatives of CAPE just stood up and said, pay attention to these guys. They got some good stuff. And they presented their stuff. And then the government representative came running over to CAPE and said, what are you doing here? We got to talk. We got to talk. You've never been here before. Well, nowadays, of course, there's much more going on. But I would say that, for example, we've got 15 members right now. Well, I was invited to come and tour the David Suzuki offices in Vancouver about 10, 12 years ago, and they had 60 people in their office, all doing research. They were actually studying scientifically and in detail some of the problems that have served, their evidence has served as a basis for the work we're doing and other groups are doing. So I would say the collaborative spirit is really important here. Not to turn our noses up at non-physicians organizations, because some of them do really high quality work. I mean, some of them are pretty flashy, but others have done some very solid work, and we can collaborate with them. And by the way, this whole collaboration thing, I've stolen it from every Indigenous person I've ever had a chance to talk in depth to. They've been trying to teach us this for 150 to 250 years, and we've been relentlessly telling them we're smarter than you and we know what we're doing, which is such a shame, because A, we didn't know what we were doing, and B, they were really willing to help us. And now they're starting to do it, and we're starting to be less sort of closed-minded, and the result is fabulously transformative.
I want to add a quick note actually to what Warren is saying on the CAPE side. So if you need to brush up your advocacy skills, and I think every single one of us needs to, CAPE actually has an advocacy and mobilization program for healthcare professionals that we just launched this year in 2022 that trains healthcare professionals how to be effective planetary health advocates. And so we have 50 healthcare workers. You don't have to be a doctor. You can be any healthcare professional engaged this year. And then next year, we're taking in another cohort. And so you can engage with CAPE board members, our amazing staff who are working on teaching how to mobilize, and other people who are climate conscious and interested in becoming more powerful advocates. So you can up your skills with us.
I'm smiling because, Melissa, when I went down to a big family physician conference in Orlando, Florida, about 20 years ago. And I was speaking on physician advocacy and a bunch of slides. And the only people in the audience were the other Canadian physicians who were also members of CAPE, who came to the presentation I did. Not a single family physician from the entire 3,000 attendee conference actually turned up. I mean, if that should encourage, I hope that encourages all of us to realize that the tide of fate is moving forward, and we have an opportunity to capture some of that momentum. But it's lovely to see the changes that are taking place in public interest in what we're saying and what other groups are saying as well.
Thank you. Dr. Courtemanche?
Yeah, this goes in lots of directions. So there's a group called Cascades, which put on courses for physicians that you can do online and get your CME credits for, and they have toolkits, and they do the meter dose inhaler thing, and they talk about greening the operating room and all sorts of different avenues. The medical students have been out in front of practicing physicians for quite a few years now. There's the Canadian Federation of Medical Students Heart Curriculum, which was the climate-wise. There's climate-wise as well. I mean, the CMFS heart curriculum was supposed to be in all the medical schools by 2020, and it's still not embedded in our medical school at UBC. My colleague, Dr. Jeff Blair, who was the undergraduate program director for surgery, snuck me into the curriculum. I get 1 hour on planetary health with all the UBC medical students when they do their introduction to surgery block. So that's where they get their planetary health talk. So that's been good. A lot of what I do is peer-to-peer education through the planetary health talks that Dr. Rashmi Chadha and I do. And I've gone away from the word advocate, but now I've changed to the term catalyst. One of my mindfulness gurus for a course I said he had his thing, his tagline on his email was mentor and an arrow coming in, and then coach and an arrow coming in from the other side. And then in the middle, he had the word catalyst. And catalyst is that little one spark in the chemical reaction that can make the entire reaction change, even though it's only a tiny, tiny little piece. So I kind of think that's important. It's like Kyle Merritt, who diagnosed a patient with climate crisis and wrote it on their chart, and that made international headlines. That was last summer. So, so those are the things that we need to do.
I think it's really helpful for everyone that's been listening. I think that no one can argue with any of those concepts. And you do raise a good point. I do think of I think of interconnectedness within our systems. I feel like we've been operating in silos in many ways on, not just healthcare, but in different systems, whether it's justice or education. And what are the opportunities moving forward if we could really come together and this convergence in the spirit. When you say Indigenous relations, I've heard the word collaboration, true collaboration, in the spirit of true collaboration. And when I think of our Indigenous people, our most marginalized populations, and I think of their land, for example, their land, climate change, how it's affecting. So imagine if we had a walk towards the TRC, or the Truth and Reconciliation, with that lens in mind, because their lands, or they've nurtured their spirits for centuries, and they've been trying to teach us on their lands of their ways, and to honor the natural environment as well as their healing. And imagine if we could expand our own collective consciousness to think about those things. And all three of you inspire me. I've had thoughts and ideas of when I heard you say the toolkit, and Melissa, when you spoke to about the physician that changed, because of the campaign for fossil fuels, and was compelled to change and take that, almost reminds me of participating in the Parent Advisory Council, or the PTAs, and, becoming that advocate and agent of change on so many levels. But what if we were able to equip our children through the Ministry of Education with climate toolkits? I mean, I've been thinking about a first aid toolkit for anxiety and for mental health for every school in the province. But I really think that, we could pair them together. And if we know that children are having climate crisis provoked anxiety, and imagine if we say, what's the prescription? You go to nature, you return to nature, and you look at the biodiversity, and you study the ecosystem. Again, it brings us back to the interconnectedness and the wonder, the sense of wonder, which is, again, mindfulness in nature. There's so many ways that we could inform, guide, and really revolutionize the way that we deliver health, education, and the walk that we have with our Truth and Reconciliation journeys. So those are just some things to have our listeners think about. But I want to leave this with an optimistic approach. And I know it's been really daunting because of what lies around us is consuming and can affect people's anxieties about how rapidly the environmental space is changing. But what's one thing about climate and planetary health movement that gives you hope? I'll start with you, Dr. Lem.
You probably know I'm going to say this, but honestly, the growth in the nature and health movement, and awareness that healthy ecosystems are essential for our health. What I saw when I and my colleagues, before we started advocating at this intersection, I could see that health and the environment really existed in two separate silos. And I can see those walls breaking down. I can see and hear these conversations happening between industries and government sectors that weren't talking before. And that gives me personally a lot of hope.
Dr. Kurt Mosh.
I think the number of people getting involved in advocacy on behalf of the planet is increasing, and that's a good thing. People are starting to understand the intersection between climate and social justice. Like Dr. Bell said earlier, the worry is that hopefully it's not a little bit too little and too late. Back to the medical analogy, we actually have the diagnosis. We just need to figure out the urgency and move forward from awareness to action. The challenge is who is going to lead. So I actually did a poll prior to one of my planetary health talks, and I got a large number of respondents. And the answers suggested that people are actually willing to change their behaviors and what they do, but everybody's nervous. They don't want to be first because it's a risk. Safety in our society is based upon money, not on community. And that's a big problem, because if you're going to start giving things up, and then you're going to risk your financial security because you don't know if your community will support you. So we need to really think about, value changes within our society. People want to see major institutions like banks, corporations, and government acting, and then they'd be quite happy to follow because they see, oh yeah, the country's going this way, we'll do it. But no one wants to individually strike out on their own and give up all their retirement savings funds and move everything, and then realize 5 years down the road that no one else did that and no one's going to help me because I don't have anything left. So we have to figure that out. So I think that the thing that inspires me is that I'm now working indirectly and partly directly with the Royal College. Like, we're going to put planetary health into the curriculum for specialty medicine, just like the College of Family Physicians has already done. Like, the specialists are behind, but the fact that people are getting involved, this is becoming like everyday conversation. As an impatient surgeon, I just wish I could see a little more action and outcome.
Thank you. And Dr. Bell, what do you think and your reflections on hope?
I just thought I was amused by the fact that I must be the oldest guy in the room, because people can't decide whether to call me Warren or Dr. Bell. But all those who wish to call me Warren, feel free, and those who want to call me Dr. Bell. At any rate, what gives me hope is something that you just touched on in passing, Doug, and that is the notion of justice, and the fact that it is now irrevocably tied to our addressing of the ecological crises that are mounting around us. We just can't deal with them in isolation from one another. And the principle underlying that is the notion that we share everything. I mean, whether we like it or not, we share everything. I mean, even our bodies, when we die, they get redistributed around the world to other life forms. And so our lives are shared at every level. But we sometimes like to think that they're not. We like to think that if we're thinking thoughts, there are thoughts and nobody else has them. And then we discover that there's a lot of people that have the same thoughts. And then eventually we realize that fundamentally our human consciousness is tied to that of all the other humans who live around us. And that is what is our conditioning factor, not outward superficial characteristics, but this essential kind of shared awareness of what's going on in the world. And that, to me, as we approach that, we're getting away from particularities and narrow thinking into sort of an interconnectedness that is unbroken, was never broken except in our way of conceiving of things, and that we are tied together. So we have to solve these problems by sharing the burdens and sharing the solutions and the outcomes. And that gives me, as I see this consciousness rising, that gives me a huge amount of hope.
Well, you heard it from the three leaders that have been so kind and allowing their time for all of our listeners and their colleagues on the ground. And they have made substantial impacts for climate change for all of us to benefit from. And hopefully, I have hope that this conversation is a game changer, because I really do think that we need to talk about things that affect all of us, and healthcare in health for our patients, but also ourselves and our commitments and our responsibilities to really come together and make a significant collective impact. My hope is that a few of our listeners decide, we need to really come back to our consciousness of ourselves and our own journeys and our paths that we're walking, and allow the efforts that have been made so graciously for us. And I do, when I hear all of you, I know that you've all made some significant contributions into the way that we're walking in the world, and you've allowed us to have this. And Dr. Bell, from that birth of idea, and to see the organization and how it's come, and Dr. Courtemanche, your grassroots activism from the OR to the streets and to advocacy in the public interface, and to really be bold in that direction and not backing down, as well as your significant partnerships with the Indigenous people and your commitment. And Dr. Lem, of course, bringing it back to nature and parks and prescribing, as well as the reason that you intentionally began this journey was your own path in your own family, in your own household. And now, again, creating a legacy within your own son and leading the way forward for the generations to follow. So that gives me a lot of hope, because I know the work that you have laid out. And I am hopeful for the listeners as well to be feeling compelled to make our consistent efforts, whether they're through our children or through our legacy or through our collective impact. I really do think that you three have been astounding efforts, and your leadership has been really admirable. So I'm hoping that all of our colleagues that in one way, shape, or another can continue to make that journey. And it could be simple or elaborate, but it all starts with one step. And so thank you so much for joining me in all of your capacities tonight. And I'm really hopeful for what we can continue to connect on and continue to lead within this province and national and global health landscape for all three of you and your contributions.
Thank you so much, Ramneek, Dr. Dosanjh, for really charting a new course for doctors of BC in this area. And you've been the spark plug for it. There's no question about that. So I personally am grateful. I'm sure the rest of us are as well. This is really a lovely turn of events. Thank you.
Thank you.